No.
No one
They
was
started
there.
tearing it down. It ended
Oh,
three.
that kind of dead energy.
And all of a sudden it was like, boom! You know, like
Yeah.
they're just like,
There was a
really-
different type of energy.
Yeah.
and
A destructive
and
one.
I was like, is it like getting torn down right now? And it was. It was literally, and they come in with like 100 people. They're just like, boom, 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 boom. So
You
it
know,
was
the
loud.
right
I
place
was-
at the right time, maybe that was the reason
I
for
don't know,
something,
it was
right?
crazy. I was like, just ignore it. We're gonna keep talking. We're gonna finish up. So we did.
Yeah.
Isn't often our lives like that?
But that is,
You know, something
100%
destructive is happening behind you and you just gotta keep
true.
going.
You gotta keep going. You gotta figure
Yeah.
out how to get.
Yeah, yeah.
All right, well,
Yeah.
welcome everybody to our second live episode of Rev Cycle Unscripted. Here we are, Katerina Manal.
Unscripted.
Hello, Ben.
say hello to the crowd.
Hello, crowd.
Everyone.
Hello,
All right.
Benjamin.
All right.
HFMA.
From McLaren. I mean, maybe give a little bit of background. I want to know from each of you, how did you get into Rev Cycle?
Cool.
We
Each
went
of
to
you-
revenue
and then
cycle
what's your
school.
current role?
That doesn't exist.
That's right. That's right.
Yeah, how did I, by accident, honestly. I went to school in Eastern Europe to be a health inspector. And I graduated as a health inspector, started doing that work, and I said, absolutely not.
You
This
graduated
is not
as a health
for me.
inspector?
Yes, there was a program in Europe for a health inspector.
Wait, where were you in Eastern Europe? You're like, that's very general. I don't know.
Yeah, so I'm from Northern Macedonia, but I went to college in Bulgaria.
Oh, nice.
Yes, I graduated in Bulgaria. I worked in Bulgaria.
And you grew up there.
Yes. Yeah.
Okay.
Was born and raised there, and then I didn't like what that
Had to offer.
had to offer. And then I went back to school for a healthcare management, but in Europe it was very different structure, socialized healthcare. And I got an opportunity to be visiting the United States as a student exchange program. So I came here and I liked it, and I walked around, visited some universities, and then I transferred to as a healthcare management program here, which got me into starting with coding, getting certification in coding, getting a job as a coder. That was not enough for me either. So I went back to school and I got my bachelor's and my master's in health informatics, and that's how I got into the revenue cycle. Primarily, I was more in the mid-revenue cycle for most of my career, and just recently I am now overseeing a revenue cycle department from all four perspectives.
You got the whole thing.
Yes,
Right?
right now.
Wow.
I am lucky though, I have an awesome team.
That you do.
So they make my job very easy.
So when did you move from interview to US?
I was, as soon as I turned 21, I moved to the United States.
you like
Yes,
gone.
as soon as. My birthday's in March and I moved here in end of May.
Wow.
And I'm not going to tell you how many years
No,
I've
no, no.
lived.
I'm guessing it's only 10 years.
Don't do the math.
It's only been 10.
So that's my story.
All right, Manal, what about you?
So we are as global as it's going to get today, right?
I love this.
So I grew up in the UK.
Oh, you did?
I did. So my father was a diplomat. We grew up there. I finished my undergrad there, and then I came here. I met my husband, and he was in the U.S. So lo and behold, as I was applying to grad school, I applied all over the country, thinking that the U.S. is like commutable distance from each other, right?
So true.
Because the UK is a tiny
University
island.
of Texas, University of
Yeah, I
Miami.
can just
Those are
commute.
close.
It's all right. Yeah. So anyhow, I landed in Michigan, School of Public Health. So I actually studied epidemiology. So very far removed from revenue cycle or finance. But when I was there, I did some projects, and I felt like I really wanted to be close to the healthcare system. I worked with like hand washing studies and quality improvement. So anyhow, later I joined Oakwood in the quality and patient safety department. I spent time there, and then in the analytics space, moved into performance improvement, and over time took on a project to consolidate the CDI department between Oakwood, Beaumont, and Botsford.
Oh, I didn't know that.
Yep.
Okay.
So that was one of my big projects during that merger, and that's where I got to know Lynn Flynn very well. And came back, left for a year, and then came back to Beaumont to head the performance improvement team for revenue cycle. So I showed up with the printout of the revenue cycle, to make sure I don't forget where it starts and where it ends.
The printouts.
I was like scheduling registration.
Yeah.
I was very new to revenue cycle because my background was all quality.
Yeah.
And that's where I started working closely with some of the folks that you know, and just put it up from there. And I love data, so revenue cycle was a perfect fit for me. Just the idea that you can map a process and follow it with data, as opposed to, so just the rest is history. I did that for a while, and then now at McLaren I'm doing the same thing. Been there for about 5 years.
What do you lead at McLaren now? You're over analytics, and I know you're doing automation because we know that, but I don't know what else.
So we're very fortunate at McLaren in that our process excellence team is actually the end-to-end, like what you need for improvement. We do everything from like the training, we do analytics, we have automation, process improvement, we have project management, vendor management, and then we also have the informatics team that handles our eligibility tools, our scrubber. So we have our hands in kind of what we need to do to drive improvement, working with operations. So we're pretty, well-supported team. So we've been able to make a lot of impact in the last couple of years.
And how often do you get back to the UK?
Maybe every other year.
Oh, okay.
Yeah,
all right.
yeah, every other year.
Is your family still?
Yeah, my family's all there. That's our hub.
Oh, nice.
Yeah.
Okay. Nice. You know what? I've never been to the UK.
Oh, you have to.
Isn't that weird? My mother lived in Switzerland.
Oh, yeah.
And so when she was there, we went all over, but I've been to Paris probably 6 times. But I've never gone, for some reason, we never made it. I don't know.
So I'm biased towards London as opposed to the UK as a whole, because I grew up in London.
Sure.
Yeah. But London, you need to, it's a stop you need to allocate maybe 4 to 5 days. It's a lot of fun. Lots to see.
I'm game. I just heard it rains all the time. Some of the food's better. It wasn't good food for a while.
You're in Michigan. You can handle London rain.
That's true.
Trust me.
It's true.
They have pizza everywhere. I mean,
I was not thinking you were going to say that. But okay.
There's something to eat.
All right.
Anywhere you go.
I heard the food is awesome now. So.
Yeah, the food scene is
Gordon
great.
Ramsay changed everything.
Yeah.
I'm kidding. I don't know. Well, that's cool. All right. So now we got a little bit about you guys. What if I gave you like a magic wand and you could fix one thing that you're working on, right? Or you in your like worlds?
Jeez.
What would you fix? Or what would you do?
One thing.
Oh
boy.
You got one genie. You got a genie.
I'll buy you some time. I think data. I think like easy access to data. We struggle. I mean, I think everyone struggles.
Because you got lots of it, but it's like getting the right kind, getting the right way.
At the right time.
They need information, not data, right? We have data, but how do you, organize it, to make it accessible at everyone's fingertips, the way you get data for any other thing that
Right.
you do.
So she said data. I like that.
It goes along with the easy button.
Exactly. It's like what we heard about today about you could have technology, but if the application layer isn't useful or easy,
Did you find it fascinating? So we're referring to, for those who are listening, and not like, what are we referring to? We listened to what's his name? Neil Cass? Yeah, he's
Zach
Cass. He was the open AI kind of go-to-market guy, and he did talk, and so we were all listening to that. I'm curious to know your thoughts on how he was saying that the internet's going to, has been built around this visual concept that we can visually see everything. And he said what's happening right now and in the future is going to be built for, like, there's going to be trillions of pages that are not, they're just text. They're like,
it's just data.
It's just data.
Just data.
Because it's built to be read by like an agent, like an AI agent. And I'd be curious to know your thoughts on this, because I think that's so true. Like, I think now, like, when we started tarping, it's like, yeah, I guess we got to get a website, but I mean, like, I'm not spending more than, I had Tina, I'm like, Tina, can you just build a website on Squarespace for $20, I mean, like, because I was like, I just need to look credible, but no one does that anymore. So I'm just curious to know your thoughts, like, on the data piece, because it is like the accessing the data, right?
Exactly. And honestly, the whole idea he was, in terms of like, we're not going to be interacting with screens eventually. It's so hard to
envision it.
All I can think about is, are we going to have, wearables that are not only processing the data, but somehow we've programmed our preferences, and it's kind of like just giving you the feedback. But then, kind of going back to where we are now in terms of basics, it's kind of what we have in revenue cycle. Right? We do have a lot of really cool data sets and tools that have data, but the architecture or bringing it together so that you can tell a story, that's where that's what allows you to make decisions using data.
So true.
Yeah, that's what.
So true. It's funny because I got this, I was working on this other thing and I got this like 300-page deck. I'm not going to say a consultant made it, but I'm just going to say like,
Consultant made it.
Maybe.
Did you ask to give you 6 bullet points after that?
No, what I did was I pay for ChatGPT like the $20 a month. I fed it into ChatGPT, which if you pay for it, you can it's all private. You can keep those files private. And then I just started asking it questions that I wanted the answers to.
Yeah.
It took my time of like processing down from, it would probably take me 6 hours to get through 300 pages, even just skimming it, right?
Yeah.
Down to like, I think I did that in 30 minutes. Like I was able to just kind of like, okay, well I want to know this. And okay, can you take this and summarize what is I saying here? But I think the same thing, like the way that I see that we would interact with data in the future is, it's almost like, the way that I think will change substantially is my take. I would love to hear your guys' opinion. Is that the way we interact with it will be different. I'll be able to just voice ask, here's what I would like to see, or tell me what happens here. So the way I'm interacting with the data is almost like the operating system. Because I think what he was describing was that, like,
he said we were going to be carrying our computer on us.
Because the phone can't be like the end all. Like, there's no way. In 10 years, 20 years ago, we wouldn't imagine that we were carrying phones around, right?
Computer.
And 20 years from now, there's no way there's no way we're carrying phones around.
Yeah.
No.
I just can't believe it. We couldn't be better than that. Like that feels like a crime.
I think definitely we're going towards like the futuristic movies that we watch, that we all watch.
Right.
That's exactly where we're going. And we just need to be ready.
Yeah. Or ready for
and accept the challenge. Yeah, ready for the difference and accept the challenge and change with it, right? I mean, even when he was talking about productivity, right? With what we have today and how much more we're productive. And as you referenced earlier, with AI, how much more you're able to be productive and narrow your time to read, right, in quotes, 300-page document and understand and ask questions in short amount of time.
Right.
Those are some things that shouldn't scare us. Those are some things that should, encourage us, right?
Yeah.
To be optimistic and to look forward to it and,
Yeah,
to think how we can keep the humanized component and how we can keep that empathy and whatever.
Yes.
Everything that goes along with it. So.
Yeah, like those like blurbs he put in, like the curiosity, the empathy, like all those things that you never want a machine or a tool or AI. That's always going to need to be a human-driven behavior, but using AI to enhance it. On the data front, I am excited about like the concept of agents helping with analyses, right?
Yeah.
So that I think is going to be changing the space of like analytics, right? Like today we define what trends to look for, we define KPIs, we define all of that, but we're just defining based on what we know to look for.
No, that's totally true.
Yeah.
I think about my daughter who's like 16. We have similar ages, right? Kids. Yours are younger.
My son's 16.
Oh, that's right. You have a young one.
But I'm going to stop mentioning him from now on, right? I'm just going to. I have a 10-year-old, 1-year-old.
So we all have 16-year-olds.
Yeah, pretty much.
But she wants to. She's really good at computers. She's genius smart. She's on the spectrum, right? And because he was talking about there's more geniuses than ever.
Yeah.
But I would also say there's more autistic people than ever, and I would say that that's probably for a reason. My wife is convinced of this. That's actually
because
we're evolving to this other kind of, because they have capabilities like my two daughters are on the spectrum. They have capabilities like I don't have any clue. Sometimes they're both artists. They're both well, my oldest is trying to figure out what to do. We pulled her out of school because it's interactions this is not good, right? So she's so smart. She took a college class. She got an A, right? She took a 4-credit college class. She's a sophomore.
Wow, that's impressive.
Yeah.
But I'm if I'm trying to send her to school or college, this is where I start to get and she's gonna go. Let's just go say she goes to computer science. do you think that college is caught up with like
With the brilliance, I don't think so.
with the brilliance, but also with like where AI is at that point?
Yeah.
Like, he's saying it's like changing every doubling or tripling every 7 months. The capability. Well, I didn't write my curriculum like last week for my class. I've already been teaching that class for 10 years or 5 years. So I'm like, do I encourage her to go? Like, I had been encouraging her to college, but now I'm like, I don't know. She just starts learning, starts doing automation, like, or whatever, working for Tarpon. I don't know. It's just interesting.
It is, it is nerve-wracking as our kids get closer to college, and you're like, what do you advise them? Because you hear so many like people who follow their passion, follow their interests, and they're able, like you said, like follow your brilliance, and there's resources out there beyond college to like teach you those things.
And it's the expectation, like, well, I could just go to college. Like, do they?
Yeah.
Because I was fascinated because they're saying OpenAI and like Palantir and others are like hiring right out of high school.
Yeah, that they're waiving the college requirement, which is impressive because they can get that brilliance just straight out of high school.
I mean, think about you guys work with, I won't mention last time.
Yeah.
When we worked together before, they would not promote her to a director because she didn't
the requirement.
have an undergrad.
Yeah.
I'm like, she's been doing this job for 15 years.
Yeah.
She's the best person we got.
Yeah.
I remember how many times I argue at HR. They would not do it.
Yeah, especially like certain industries, like we're still catching up, right, with like what's required for a job. Like we're constantly having those conversations with HR about
constantly.
Like you have a perfectly good applicant who's shown like, you know, the desire and succeeded in various, but they just don't fill the check boxes. Right?
Check boxes.
Yeah.
Because they treat them like a nurse or a doctor. Those people need school. I get it. There's a reason there's colleges exist.
That is true.
But this is a different ballgame.
Yeah.
It's interesting.
Well, you know, it's interesting because clinical space, like medical school and nursing school, we've been talking about it for a very long time, how those schools haven't caught up with the advances in medical care either, right? Like, and the expectations around patient experience, the expectations about just the financial system around healthcare, right? We've been talking about that. Right. So imagine just the AI component in other spaces, like how long universities being able to catch up is going to be a challenge.
Yeah, totally. All right, Katerina, what do you think?
I think that we're stuck in generational guidelines where we are in healthcare right now. So, I mean, even he mentioned that, saying that we should look past some of those requirements and bring those brilliant minds and consult with them, even regardless of what age they are. Also, if they have something to bring to the table that will take us places, then I think we should entertain that.
Mm-hmm.
Yeah, for sure.
Yeah, and we've done, as you know, some automation. We're really taking it off right now, even more with our partnership. But even with some of the other partners that we just started working, some from the clinical and mid-revenue cycle perspective space years ago, we've done so much. So I don't know, I'm very, very have a positive outlook on how things are going to roll out. They might be going really, really fast, and I think from a human perspective, that is what us human are scared of.
Sure.
You know what I mean? But I don't know. I feel like if we look at the positive side of it and just embrace it, I think if everyone gets on board, we'll do great things.
Well, for sure, it's like the billing rep that we know today, Susie, who's been your biller for 20 years. To think that the job's going to be exactly the same.
They're not.
5 years from now, or 10 years from now. It can't be. You can't imagine that it shouldn't be.
No.
Yeah.
But it is preparing the people as well. So even now, when we were going through the ideation sessions with our staff, there is fear, right? Because they're scared. They're like, oh my God, why are we doing this? Are you going to replace me? And it's just
the
explanation. It's the first topic. It's the first topic, and they're scared. And at least sometimes they might not even provide you all the steps because they fear that if you were to go and build this automation, that they will be out of a job. So I think it's just educating them, making sure that they're open to change, that this is the future, that if you don't move with us right now and you go somewhere else, the same thing's going to happen when you go somewhere else. So you got to go with the changes, but it is the fear in the humans. And I know Zach talked about it as well. He's like job displacement, right? Yeah, we see it more of there will be definitely different types of jobs, very different types of jobs that what we're used to today, what we're doing today.
Totally.
Yeah.
Yeah, Phoebe from Geisinger tells a story. Did you ever hear this?
No.
Where their first automation, they've been doing this 5+ years. First automation, they're all like excited. Okay, we're gonna get this done. Get it done, and then it like fails.
Oh.
And they're doing this like debriefing. Like, what happened? You know? And one of the ladies in like the room and part of this whole thing, she just breaks down and starts crying.
Oh.
And
She's like, I didn't give you the steps.
She had purposely given the wrong
There you go.
process
Yeah.
because she didn't want it to work,
Yeah.
so that they wouldn't continue to do automation.
Yep.
I did hear that.
She did break down though and like told them, but I was like, oh my god,
Yeah.
that's so true.
When I went to a UiPath event, and some of the folks were saying that most common time where you find requirements is in user acceptability testing.
Yeah.
Because,
Of
like you
those
said,
things. Yep.
so it is something on our mind, and as we go through the process, and it is. We've had the folks that we've started with and we're working on, because one of our criteria as we worked with the Tarpon team is an engaged team, because it's so important to have the right team to start our automation journey with. Is they're like, here's what I hate about my job, and they are like going down to the details. So it's actually it's been a positive experience so far, and asking them that question of like, what do you really hate about what you're doing? What do you feel is monotonous? What would you like to be spending time on? Because there's so much to go after in healthcare. I mean, there's work for everybody. It's just we're trying to, put the teams on the stuff that really requires the cognitive thinking and automate what we can. So far, there's been a lot of really good feedback on that. But we go live with our first automation in July, so we will report back.
I remember when we moved at Oakwood, we moved to Epic. You weren't there yet, I don't think.
Oh, I was there, but I was in quality.
So we moved, and in the CBO, you probably, when you guys were in Cerner, we had some people that did not know how to use a mouse.
Yeah.
So, I didn't hear about that though.
Oh yeah, they were like,
green.
they did not understand the concept really, besides logging in the machine like at the beginning and getting to like the green screen, right? They were wizards on that thing. They like all the keyboard shortcuts. They could not navigate a mouse well enough. And so they eventually they did the rundown, and then they were like, they just retired. They were like, we're not doing it.
Wow.
There's like 5 people. So I tell that story now to younger people coming in, and they're like, what? I'm like, I'm just telling you, like, those kind of shifts we're going to have.
Like fax machines? Yeah. No one has fax machines other than hospitals now?
No, it's so sad. I don't even want to talk about it. Fax machines. All right,
I mean, if you ask the young generation how to use a fax machine, they wouldn't.
They don't even know what it is.
They would not know how to use it.
My daughter was like, "What does it do?" And I'm like, "Oh, it's
It's like a text message.
It's complicated."
Yeah,
it's complicated. It's like a text message. It comes
like
on
a
paper,
text message.
but the paper was like real rolly for some reason. Do you remember that?
Yeah.
It wasn't even like the flat pieces of paper. It was like the facsimile paper they call it.
Oh boy.
I don't know. I am happy to be part of the generation to see the old and the new. Like I feel like we're in between.
Both.
Yeah. I mean, I can dial a old phone with rotary phone. Yeah. My kids don't know how to do that, so we play games. We do testing. Let's see if you can call somebody. So those are some.
It's a game.
They're cool things. I mean, I'm kind of excited about it.
All right, so if you had a genie, you didn't get to do your wish.
I didn't get my wish. I said press the button. If I get a genie,
what would you change?
Is this going to become an assignment for us to work on?
I know. I don't know that I would change anything per se.
Or what would be better? Yeah, I don't know.
I think we, like Manal said, we're very fortunate with the group that we have. Everyone is working really, really hard. But I try to talk to the staff often I feel like all the time we're just ready for the next thing, the next problem to solve, the next fire to put down, the next automation to put in place, the next, I don't know, biggest and better system that's out there. Let's figure out how we can do the same. And we often stop to pause and to celebrate all the wins that we've done, all the good things that have happened, and to see how we've gotten from here to here. So I try to do that with the team because even myself, I often find myself in times where I'm just like on the go. And I'm like, oh my God, I didn't feel like I was productive today at all.
Yeah.
What did I do today? But when you just stop and think for a second, our KPIs are amazing. Oops.
Too early to
We're
take it
good.
down.
We've improved as a team. We all, I feel like, think alike. So I feel like I have the very good thing going on that at this moment I don't really need a button. You know what I mean? I feel like we have our strategy in place. We have all of our performers that we wanted to get them approved to start doing the work. We have it, and I just want to go with the flow and see where it all ends. And like I said, just to remember that to be kind to each other and to always go with a positive outlook and not have an ill intent or make a process not work just because I don't want my job to change and things like that. It's just making sure that everyone understands that change is inevitable. Everything's going to change and you just have to go along with it. So
Yeah, I like to assume the best. We have a core value at Tarpon. That's we treat each other like good friends.
yeah.
Is a
That's
core
a
value,
good
and it's
one.
Yeah.
the intention is like you assume the best, even though
You
someone
do.
might say something that you're like, "Whoa, why'd they say that?" But if you assumed that they were a good friend,
Yeah.
Yeah.
they wouldn't. You're like, well, okay, maybe they didn't mean what I was thinking. They meant.
Yeah.
So
Yeah.
yeah, I like that. It's good. What do you guys foresee for the rest of the year? What are you guys focusing in on?
We are full blown now. Like I said, we're doing the automation. We are working on a lot of initiatives to improve patient experience. I know the earlier talk that we heard about is just allowing the patients easier access to, I know from a revenue cycle perspective, to easier access to pay their bill, right? Multiple ways to pay their bill. Doesn't have to go through hoops and rocks to get there, which of course keeps our hospitals operational as well. So we're working on a lot of initiatives there.
Is that what you consider patient experience? Like, is that what you're talking about?
Yeah. It's part of the patient experience, right?
What else are you
From
guys
start
working
to
on?
beginning.
And patient experience, like what else are you guys thinking?
We're looking from all of it, from
Yeah.
start, from how they can self-register, self-schedule, all the way to the end of how they can basically make it seamless, that they can access all their clinical data as well, be able to talk to physicians, and be able to easy pay. So that's one of our, I'm gonna call it, one of the primary initiatives. We have several primary initiatives that are kind of running in parallel. We're getting ready on the back end for like the clinical denials because, as you see, we're not the only health system. We've had the increase in clinical denials, so we're kind of trying to strategize around how to have that first level pass of automation with automation and then embed the humans somewhere in there
Yeah.
for that second look. So we're working really hard on those initiatives as well.
You guys seen something specific in clinical denials that you're like, this is new, or it's just the same thing, just more volume?
It's more evolved. The same thing, but more evolved.
Yeah. And different, right? Like it's like on all fronts, like denials, audits, recoupments. It's like it's not the same portfolio. We're kind of finding that it's a mishmash of different ways that the payers are.
It's a lot of shifts from the payer side.
Yeah.
A lot of payer policies that are just popping up, right?
It's like, oh, we changed this.
Yeah. Sometimes you know, sometimes you don't. Sometimes you find out, oh, what happened in April, So
Yeah. Interesting one was you're denied on the front end, and then it's we win, and then it's later appealed, and then we don't, and it's like, oh
Yeah.
it's just
The appeals are wild stuff.
it's
Yeah.
crazy scenarios like that. Yeah.
Well,
a
good
lot of-
stuff. You
yeah.
guys are doing great stuff over there.
Yeah. I feel like the energy's there. We're all focused, and it's a lot of work, though. The team works really, really, really hard. So I do compliment them that they just want to come to work every day, do the best they can, and have the best outcome that we can in today's environment
Yeah,
with the
pretty
tools
easy.
we have.
You guys are doing good work. I appreciate it. Thanks for
thank you.
coming on. This is good. This has been
Yeah,
great.
thanks for having
It was
us.
easy.
Maybe we'll do better next time.
Well, you guys did great.
Well, thanks, Ben.
Thanks for having us.
Yeah.
All right, awesome.